Hello, today I'm going to explain the hardware of DocBox system. So first we have HP Engage One Pro system, which is a combination of a CPU and a monitor. With that we also have a barcode scanner, and the third main instrument is advanced fanless hub. All the cables from the monitor as well as from the devices are connected to the fanless hub, and then all the data is transferred to the monitor. Thank you.
Good evening. Today I'm going to make you walk through the entire process of DocBox, the clinician's assistant in critical care. I'll make you walk through the entire steps of how the operator can log into the device, how the patient can be admitted, how we can connect the devices, and how the clinician's assistant task can be performed by the nursing staff. So let's start with the first step. The first step is we provide the operator barcode to all the users who are using DocBox platform. So they can just scan the barcode, and once they scan the barcode, their name along with the role will come here. The second step they can go to is the devices. Now I'll make you show how the device can be connected. We'll first connect the physio monitor and we'll hit touch over here. And I can scan, you can see the barcode over here, and I'll just need to scan the barcode and the device tries to connect the monitor. In the similar way, we can connect ventilator also, and we can do it parallelly while the monitor is getting connected. I'll touch over here. The ventilator barcode is scanned, and it is now trying to connect the ventilator. Monitor usually takes around 7 to 8 seconds to connect, and the similar time has been taken by the ventilator. Now we can see that both the devices are now connected, the monitors and the ventilator. Now the next step is we'll admit the patient. So we have a patient UHID in this format, and we can just need to scan the barcode of the patient. Once the patient barcode is scanned, there is no need to enter the last name, first name, date of birth and admit patient column. The patient UHID comes over here, and the name and date of birth will automatically be pulled in from the HIS of the hospital. The demographics data we can see that has started coming from the HIS, and the nursing staff can straight away go to the clinical flow sheet, hit on task and select the task whatever they want to do, hit on submit, and now this list is completed. So you can see the patient name and date of birth, everything is being pulled in from the HIS of the hospital. So we can start. You can see this is the graphical trend form, and the task can be started from hemodynamic. You hit the refresh button, this is the refresh button, and the data is getting pulled from the monitor. Anything they want to enter manually can be done, like ejection fraction. If they want to enter ejection fraction, they can just hit on this tab. A virtual keypad comes in front of them, and they can just write the ejection fraction and hit on save and sign that data. Now once you sign that data can be viewed in the summary area under the hemodynamic, and this is along with the timestamp. This is the data which we just signed in. You can touch on the screen, scroll across and see the data that has been signed by the nursing staff. Next step is to go to on task, hit on hemodynamic rhythm. That can be viewed from the monitor, and they can select whether the patient is on normal sinus, tachycardia, bradycardia, paced, or whatever is the rhythm of the patient. They can hit on save and sign. Next step is respiratory. This data is being pulled from the ventilator. They just need to hit refresh, save and sign this data. Similar is the case with ventilator alarm settings. and these are the alarm settings which are being set in the ventilator. So they just need to hit refresh, save and sign this data. For infusions, if they have already pre-selected any drug along with the flow rate and the flow rate changes, they just need to hit on edit and they can change the flow rate like from 8 to 9, enter, save. So the flow rate has been changed. Any new infusions if they want to add, they can hit on add, let's say norepi, hit on flow rate 7 ml per hour, start time, current time, save. So you can see 5 plus 9 plus 7 is 21. The system is doing the calculation also for the nursing staff. So they can just hit save and sign. Then they can go to intake column. So these are the previous task which has been done by the nursing staff. Anything they want to edit, they can edit over here. Lactate fingers, let's say it has been stopped, so they can put 0 and 60, save and sign. Output, if there are any changes, they can hit on edit. Let's say it is 10 and the urine has been changed from 120 ml to let's say 150 ml. So you can see 150 plus 10 is 170. Save and sign this data. So after output, we can hit on lines and tubes. You can go to add inputs. Let's say we have to do CVC triple lumen and the body site is right intrajugular vein. They can go to size 7.5 French, enter. Date of insertion, let's say it was inserted 4 hours back, enter. Day 0, condition of site patent, location the line was inserted was operation theatre, save. So you can see 2 lines are being signed. If there is any other extra, we can take drains like urinary catheter, urethra, size of an adult patient, let's say 14 French, date of insertion, time, day. If the patient has just arrived from OT, they consider it as 0, condition of site, location, OT. So all the 3 lines done, they can save and sign that data. Any events they are doing, so if there is any previous event which has been already entered, they can hit on edit column, change the time of the next event, and let's say an X-ray was done, so they can enter, save again and sign. Special care, it will show the previous task which was entered and they can hit on edit. They can deselect the previous task and select the different task which has been done and hit on save and sign. Blood gas usually comes automatically from the HIS of the hospital. So they just need to mention whether it was ABG or VBG or mixed venous, and the values and the results will come automatically from the HIS. They just need to enter, save and sign this data. Similarly, the lab data comes automatically from the HIS and they just need to enter, save and sign this. This Glasgow Coma scale, depending upon the condition of the patient, is very useful for the nursing staff which is new to the ICU environment, because they never need to remember the coding. They can just see the patient and hit on the condition, power, left arm, left leg, right leg, sedation score, alert and calm, pain score, responsive, Morse fall risk if the patient is diabetic. So once this entire task is done, they can hit on save and sign. Antibiotics, any antibiotics going on, they can continue with this. If the doctor had asked them to change this antibiotic and add a new one, what they can do is hit on edit, stop the previous antibiotic and put this under previous, and they can add a new antibiotic under present, let's say Josin, which is piperacillin plus tazobactam, 4.5 gram, frequency let's say it is tedious 3 times in a day, start day is today. So that was the previous antibiotic, and the present antibiotic is dosing. Now they can save and sign this data. Similarly, for respiratory support, mechanical ventilation, rest is all yes, no. And the last one is position, the head elevation and the foot elevation. They can hit on save and sign. Skin, redness scale. Once they are done with all. So all the data that has been signed by the nursing staff can be viewed under the summary area. So the doctor during the rounds, or the duty doctor, can hit on summary, hit on hemodynamic, and scroll across the screen and see all the data that has been signed by the nursing staff along with the timestamp. Similarly, if I want to view the respiratory data for the ventilators, I can again see all the ventilator data. Fluid intake output is first it will show me the infusions, so what all infusions are going on along with the intake, the output, and the system will also do the calculation. So cumulative output, cumulative urine output, cumulative balance, all the calculations will be done by the system. Any event which we have been entered can be viewed over here. Investigations is a very useful tool which can be used and seen over here. Antibiotics, we can see what are the antibiotics going on presently. Assessment was again signed by the nursing staff, so special care we can see, and we can see Glasgow Coma scale, Morse wall risk, and Braden scale. Under lines and tubes, we can see what are lines and tubes are currently there on the patient. So we have seen the entire summary page. This is the patient info page, which gives you information about patient demographics, diagnosis and history. Any alerts can be entered over here. If the patient is allergic to any particular drug, can be mentioned over here, and the plan for the day. Similarly, we have another application, which is the image viewer application. So you hit on image viewer application, the application loads, and we can see the latest image that has been uploaded. The latest image we can bring on the top, hit on the image, and the image will be displayed on the screen. There are options to enlarge the image, so we can hit the enlarge button. With a single finger we can enlarge it, and then we can move the image, and we can change the contrast of the image. That was the image viewer application, and then we also have the facility to take the print of the report. So whatever nursing staff has done in the clinical flow sheet, there is option to generate a printout of that report. They can check the next page, every page, and they can hit on give the print command. From the printer the print will come, and they can either discharge the patient when they are shifting the patient, or if they are transferring it to an area where dog box is already located, they can hit on transfer the patient. Thank you.